So good evening, everybody, and welcome to episode 3 of the Iact IMDHA Presenters Series in anticipation for the HypnoExpo 2019 in beautiful Daytona Beach on May 17th through the 19th. It is going to be a magnificent affair. So I'm looking forward to that, and I'm here. My name is Michael Watson. I'm here with my co-host, Karen Hand. Say hello, Karen.
Hello, how are you? Good to see everybody tonight.
Good to see you. In fact, Karen and I have just gotten back from Las Vegas, where we just had a wonderful time in the freezing cold weather. So I'm delighted to be back in Florida, where it is temperate and magnificent. And all of you who are looking forward to coming to the conference, just look behind me. You know, what a wonderful, wonderful environment we live in. So
I would like to just put in one little hypno note. Everything is perspective, right? We remember everything from the perspective at which we experienced it. Michael thought it was freezing cold in Vegas. I actually thought it was quite pleasant. My husband and I walked outside without jackets, and we left very cold Chicago to go to 60s and 70s Vegas at 80s and 90s for Michael. It seemed cold, but it seemed nice and warm, and the sun was shining. It was a lovely experience.
My God, my God. Well, we live in places where the temperature always has at least 2 digits, and that's a very important thing. So here we are, Florida, getting ready for the HypnoExpo, and just so all of you know, if you're on this call tonight, if you're spending an hour and a half with us here, you get an hour and a half worth of continuing education credit from Iact or IMDHA, or both, which, by the way, means that you get 3 hours worth of credit for an hour and a half if you're a member of both organizations. That's really a special deal. So,
yeah.
So if you're not a member of both organizations, perhaps you should consider a dual membership just to get the sheer value that you can get out of the presenter series here tonight. And with that said, I guess anything else we need to announce? Oh, the recording will be posted tomorrow morning, sometime before noon, actually, quite possibly a lot earlier than that, but that's the deadline that I set for myself. It will be posted on the Iact IMDHA website. It will be posted on the Iact IMDHA forum, the Mind Matters forum. For those of you who are members, you can see it there. It will also be in the virtual chapter's YouTube channel, and it will be in the virtual chapter Facebook group posted there. So there are a number of places where you can see it again. And like I always say, the presenters that we have here have so many wonderful things to say that you can't possibly remember them all, and a second viewing is certainly worth the effort. So look for the recordings tomorrow. And with that said,
I think it's time to proceed.
Well, excellent. Well, then I would like, first of all, to just begin by telling you we're going to be talking with Eric and Patty tonight, and they are running a program on May 20th and 21st. It's a 2-day course. It's the 2 days following the conference weekend. So again, pay attention to that stuff when you're making your airline reservations and all those things so that you can be here for those 2 days. It is a medical hypnotherapy specialty training that Eric and Patty have created. And well, it's going to be a really wonderful event. So I just like to start out by introducing Patty Scott, because Patty is just about one of my longest time buds and friends in the hypno world, and I am so happy here. I've done a bunch of work with Patty in the past, and it's just great. It's just great for me to be able to spend my working time hanging out, with such a good friend. She is a certified medical hypnotherapist rather, since 1992. She is a certified master trainer for the International Association of Counselors and Therapists, and a life fellow with the International Medical and Dental Hypnotherapy Association. She's the president of the Up Hypnosis Institute, Unlimited Possibilities Hypnosis, Inc., which is here in Florida. And she maintains a private practice, and she teaches hypnosis, medical hypnotherapy, and neurolinguistic programming. And prior to that, Patty had an exciting 20-year career as a professional singer, actor, dancer, and songwriter. And I just might add, because she didn't say it, she also worked in the rocket science industry. So it's an important thing to throw in. So Patty, welcome to the call. It's great to have you here with us tonight.
I've had so many past lives, it's hard to keep track of them all. Thank you so much, Michael. It's great to be here with you.
Lovely. And
And
Karen?
Patty's presenting with Eric Rosen. And I want to say my first Iact IMDHA HypnoExpo, Eric was one of the first people I met. We had lunch, got together with some other people and had lunch that day, and it was such a pleasure. So I'm glad that you're on here tonight, Eric. He holds a PhD from the State University of New York at Buffalo in counseling psychology, and is both a licensed psychologist in New York and Florida, holding practice with Family Psychological Services of Palm Harbor, Inc., providing psychotherapy, psychological testing, forensic work, and clinical hypnotherapy for children, adults, adolescents, and families. Eric is also an associate professor with the Florida School of Professional Psychology of Argosy University, Tampa. That's an APA accredited school. And I'm just delighted to have you on with us tonight, Eric, so you and Patty can talk about what you're presenting the 2 days after the conference, the post-presentation. Thanks for joining us.
Thank you very much.
Cool. All right. Well, then I'm really ready to get on with this because this is a great course, a great opportunity for folks to add medical hypnotherapy certification to their credentials. And so I'm not sure who, by the way, is going to answer my question. So what I'm going to do is I'm going to ask them generally, and then Eric or Patty, either one of you, I guess, can, verbally step forward and, and field the question. But I'm wondering just who exactly is your training designed for?
You want to take that, Eric? We were talking earlier about this.
I think it's a course that actually is applicable for both clinical hypnotherapists, licensed mental health people, and also certified hypnotists, certified hypnotherapists. We find that there's a beautiful bridge between these two disciplines, and I think more than anything, we're in the middle of a paradigm shift in the health sciences. What I mean by that is that people have an active role in their own health. And I think that both the disciplines of licensed folks and also certified hypnotherapists, they bring a wealth of information. And our program is designed to equally appeal to both.
Nice. No, lovely. So, tell me, just more specifically, help me kind of define what it is that you're covering. What is medical hypnotherapy, and how does it differ from other forms of hypnosis?
Well, that could be, both of us can answer that in different ways, probably coming from the two fields. Basically, if someone asked me that on the outside, I would say the difference between hypnosis and medical hypnotherapy is that we have a referral from a medical professional to do medical. The processes, the methods, the strategies we use are pretty much similar. A little bit more directly addressing some issues that can be underlying some of the medical or mental health issues when you're dealing with medical. And for most of us, I believe in most states, in the United States for sure, we do work through a medical referral, which is the way I've been working ever since I started doing this. And making sure, again, as Dr. Rosen's always definitely emphasizing, staying within our scope of practice, making sure that we are not stepping outside of the realm of what an unlicensed hypnotherapist is out to do and what our purview is. And frankly, I think it is an advantage that we have a lot more latitude, and we frankly are trained more specifically in some of the areas that are now becoming part of the mainstream medical and mental health communities. They're bringing in more of the whole person, and the attitudes and the psychology behind it is, I think, really well intended for hypnotists, and the training that we have, I think, is actually an advantage in working with the patients that are sent to us.
Patty said you might answer that differently, Eric. Do you have a different response?
Well, I feel that when people come in to seek a service for hypnosis, that oftentimes interwoven in this, maybe they're dealing with different kinds of symptoms. They may be dealing with either pain issues or discomfort. They may also be dealing with high stress, and we know that stress can amplify medical issues. And so that being able to help people to find a calm core, to be able to feel that they can have control in their lives. I think oftentimes when people are dealing with medical issues of any sort, Here's a feeling of not being in control, like something is happening to us. And what better medium than hypnosis to change the belief that people have about their empowerment to deal with their medical issues. So I see hypnosis as a beautiful medium to help empower people to deal with what they come in with.
And did you do talk therapy before? Or I guess you still do, but did you do before you discovered hypnosis?
Well, I actually interweave the two. So I do what would be called talk therapy or psychotherapy. And I make use of different kinds of clinical orientations, but hypnosis becomes another tool in the clinician tool belt, is what it is.
That was really the basis of my question, was how often did you weave in hypnosis even before you knew that's what you were doing? And then when you discovered that's what you were doing, how often do you use it now? Right?
Well, that's a good question. People come in sometimes not knowing that hypnosis can be a tool to help them. And there are people that come in with intentioned seeking for hypnosis, whether it's for habit control or if it's for pain issues, or it may be because they're dealing with a medical issue, even like muscular sclerosis, MS, where being able to help people to relax and to be able to find ways to manage that experience. So I find that I do interweave talk therapy, and where it can be applicable, I will offer it as a service.
What brought the two of you together?
Oh, God.
That's a long story, isn't it?
It was fate. Fate brought us together.
If I could, before we get into that, if I could just add one more thing about the previous question, if you don't mind. To me, when you talk about talk therapy, I think that's one of the reasons that the mental health and the medical community is starting to incorporate the elements that hypnotists have worked with ever since we've been doing hypnosis. And it's the idea that when a doctor is talking to a patient, they are in an altered state and they're very suggestible. And when are you not doing hypnosis would be more my question. You know, the unconscious, I always say, is always listening. Yeah. So if the doctors are finally, thank goodness, coming to that realization, and they're starting to be much more open and welcome to those of us who are trained how to talk to that part of our mind, if you want to say it like that, and to be able to speak to the person's inner self in a way that can activate those inner resources and address some of the fears and some of the doubts and beliefs and all of those things. What a great time to be in history, like I said, for a hypnotist, is to be at a time when they're finally starting to come together and appreciate the whole person. And to me, the most powerful part of the person, I always say the experts in the client, the doctor's patient that comes to me, not in me. I am an expert at showing them how to access it and how to address things and how to talk to it and get answers from it. But it's such a great thing to be able to teach people. And I think that's the difference with hypnosis. It's addressing things instead of from the outside coming in, it's from the inside and bringing it out of that person and giving them actual tools that empower them, like Dr. Rosen said, so that when they leave our office, they feel empowered. They feel a better sense of well-being and hope and some control over their circumstances. So I think and I just wanted to add that little bit. When are we not in?
Well, by the way, and not just a little bit that you're adding, Patty, the thing is that as I'm listening to that, I mean, first of all, in what you're saying is reflected, I would say, years worth of experiential wisdom, you know, from what you've done and from how you've come to understand it. There are places where Karen, I watched Karen do her, when are you not talking to the unconscious? You know, some people don't really know that just yet, and they're newer at hypnosis. And I know I asked you earlier, and so this is kind of a sort of a rehash of the question, but between that and between what we heard Eric say as well, I just realized I'm gesturing to you as you are on my screen, and it probably has no relationship to what it is that you're seeing when I do it. But
I can see you. I can't see me.
Yeah. Well, Eric as well was talking about his skill base and talk therapy, you know, and all these different things. So I'm wondering what, just again, what if any prior training or experience is needed to really benefit from your workshop? Because it seems like you've got so much of it already just going in. So how does this work out for, just help me out. What do they really need in order to be able to do the kind of work that you're going to train them in at the conference?
Well, since this is a condensed 2-day version of our actual 4-day certification in medical, we do require at least 200 hours of hypnosis training prior, because we don't necessarily go back and teach the basics, the fundamentals.
Okay.
So it is helpful to have some basic fundamentals going into this, as we will be doing work moving pretty quickly and doing some breakout sessions and things where we're not going to teach people literally how to,
Right.
address the person. But Eric, you want to add to that a little bit?
So,
Well, I think people coming in with basic hypnotherapy skills and interest in wanting to reach people that, even in building a practice, recognizing that there's need here that they may not be tapping. In other words, being able to first understand your scope of practice, so you know the language of how to reach out to other licensed clinicians or to physicians. And that may be a starting point. And even learning how to interview, which will be some of the skills that we'll talk about, so that you know how to access the information that then creates the opportunity for you to say, hey, would you be interested in this element of hypnosis to help you with what you're dealing with?
right.
So part of it is that people can walk away from this having some tools under their belt and understanding of the medical issues that hypnosis may be helpful with, being able to even understand the assortments of different medical issues. One of the other elements is there's a huge interest right now in trauma. And actually there's a term for it called trauma-informed care. And being able to understand that many medical issues may be related to trauma. And so hypnosis becomes a powerful tool to be able to help people with even those source points that can have a linkage to their health issues. So we're going to cover a wide assortment of things that their heads are going to spin, but they're going to come out with some really nice tools under their belt that they can actually start using.
Nice. Well, I'm all in favor of spinning heads. So,
And I think, and yet I do think it will be definitely also useful for people that are very new to the field. I don't want to give the impression that they have to have years of experience to take this training. My first medical hypnosis training was my very first year in the field, so obviously I was very much a rookie, and it started me on this track that I'm on now. So I think someone new, at least as long as like they have the basics, how to do hypnosis basically. And I think they can get a whole lot about this. And if they're interested in that way, I definitely want to guide them to do more training in the medical side of hypnotherapy.
And Patty, indirectly, you and Eric have both said the same thing that really caught my attention. And it was two things. Here's what I heard as I was tracking you. Basic skills in hypnosis. And the next word that I heard that was significant was interest. And that seems to be the thing that, so if you've got basic skills in hypnosis, and if this is something that you're really interested in doing, then come to this training, because Eric and Patty are really going to give you a set of tools that will create a specialty for you and enable you to really do this work. Lovely.
Perfect.
Lovely. Cool. So what kind of medical issues, well, actually, Eric started to say some of them. What kind of medical issues can be treated using medical hypnotherapy? Just to get clear, guys, so people get a sense. Here's the sort of stuff we want to do.
Well, it's interesting how that when people are dealing with any kind of medical issue, stress can actually amplify pain, discomfort. It can interrupt your self-care, creating regimens of self-care that are healthier, changing habits, personal habits. When someone comes down with a new medical issue, or even if they've been dealing with one for a while, oftentimes it means, how do you first create a better pattern of taking care of yourself? And what better way? I always analogize this, that hypnosis is kind of like going into your cell phone. It's like if you want to change your ringtone, your wallpaper, you can go into your own settings of your phone and make all these beautiful adjustments. Well, what we do with hypnosis is we teach people how to go into those settings. And we're not doing it, we're teaching them how to do it. It's empowerment. So imagine a host of different medical issues, and yet approaching it being more relaxed, being more empowered, being able to become more regimented and consistent, embracing self-care. And that's where I think we can help. So if we look at the medical issues, it can be chronic pain. It can be dealing with diabetes, hypertension. It can be reducing pain sensations, improving your sleep, changing dietary habits. I mean, if you think about it, we can actually rewire our brain with this. And that's the beauty of this. And we do it in a way that actually can feel good. That's the other part. So we actually will talk about a host of different medical issues, but there are common threads that we're going to be addressing that we can help people with.
That makes a lot of sense, because I know that we can work with a golfer, as an example, without actually being a golfer, or we can work with someone in a sport without actually understanding the sport. But I'm a little fuzzy about taking on a medical issue without having some medical knowledge behind it. You see the limiting belief that goes along with that. But that's what you said, Dr. Rosen, is really great. We help alleviate stress all the time.
And that's one of the things I hope we can do with this training, is to get rid of some of that stigma, or that lack of confidence that hypnotists can work with these kinds of things. And to let people walk out of this training with a confidence and a realization that they do have the ability to help people with these, because there's nothing, the underlying factors are the same, which again, back in the 1900s, most diseases were infectious diseases. And these days, almost all the diseases, if not all of them, if you look at all the medical journals, have underlying causes that are affected by the psychological and the stress. So those are two things that we are experts, that we can become experts at helping with those patients of the doctors, to help with the stress and with boosting the immune system. We know just going into a state of hypnosis or being in a resourceful state of some kind is going to be something that helps to enhance immunity, and that can help with cancer, with any kind of a condition. So we can do a lot more, and that's one of the things I hope people walk out with, is with that renewed confidence, that they actually don't have to be intimidated because they never heard of the disease or the condition even. And also, we're going to do a condensed, Dr. Rosen's really good at he was really good at helping me to understand the diagnostic codes, and that's something that can be very intimidating to an unlicensed person. So maybe you can say a little more about how we're going to help people with that part of it too during this training.
Well, if I could also follow up on the other comment that was made that was really good, is that we don't have to have the medical expertise to know what the disease process is and what's happening on an organic basis for people, because a lot of what we do with hypnosis is we help people to look at the meaning of what the illness is. There's a lot of, if we look at health psychology has to do with understanding how people take care of themselves. And it's interesting that when someone has an illness, isn't it interesting they say, I'm a diabetic? Well, you're still a person and you have diabetes, which means that it's only something you're dealing with. And yes, ownership is important, but we aren't what we eat. We aren't our disease. We are a whole person. And being able to help someone to understand the meaning of what that illness means to them, we do that through interviewing, and we can help change and empower people with hypnosis with that. So I want to kind of belay some fears here for people that, oh my gosh, I don't know enough about the human body to be able to work with medical things, because what we're dealing with is belief. And that's what hypnosis works with. So it's understanding what someone believes about it. I don't have to understand what all the nuances of their disease process are. I just have to know how they experience it. Nice. That's the difference with physicians. They don't, and God love them because they do a wonderful job, but they don't always look at what it means to somebody, and we can.
You know, I'd like to back Patty up for just a moment on, she was talking about working with a cancer diagnosis, for example. When you work with medical issues, boy, that opens up a can of worms, no pun or anything like that intended. I don't mean to make light of it, but there are issues for dealing with chemotherapy or other treatment. There are issues with dealing with end of life. All of those come into play when you're talking about working with the population that you're talking about. Does it not?
Absolutely. And I think it still comes down to that wonderful thing that hypnotherapists have as an advantage is that we look at the person right now sitting in front of us. And like Dr. Rosen said, what are they experiencing right now? And what is their goal? I think it's one of the things in our training we're going to talk about is interviewing skills and not resisting the urge to want to put on them what you think they should want to have. My very first cancer patient, almost at the very beginning of my career, it was quite intimidating, but it was one of the most amazing experiences for me at the time, was a lady who was literally diagnosed with less than 6 months to live. I worked with her about the last, I think, 4 or 5 months of her life, once a week. And her goal was not to be healed. It was not my job to tell her, you know, I know hypnosis and I think we can help you to get through this. No, that was not her goal. And I respected what she wanted was to die with dignity. That was really what her goal was. And thank goodness I had some great teachers early on that taught me to ask questions, listen, you know, shut up and listen. Sometimes is a good idea. And then take what they say, respect what they want, as long as it's morally and ethically okay with me. To me, what's important is where are they now and what do they want me to help them with as far as quality of life moving forward. So someone even with cancer may have different goals. And I personally believe that there are many things we can do with people who have maybe been told that it's incurable. I said that's only what they know up to this point by that particular person from their expertise doing the best they can. But I believe, again, the experts in that person, if they have something inside of them, that a feeling, a sense, an intuition, whatever you want to call it, that maybe I can beat this, I'm going to do everything within my power to help them to keep that attitude, because that, if nothing else, is going to help them to live a quality of life moment by moment, dealing with whatever it is they're dealing with. And we already know, I mean, Mayo Clinic and all of the medical websites show that hypnosis is phenomenal for helping with the side effects of chemotherapy. So if they choose to go whatever route they choose, we can help them with any other effects that might, you know, be a cause of whatever treatment they're getting. We can help, again, their quality of life to be a lot better going through what they decide is right for them.
There may be two separate answers from the two of you, because after all, one of you has a doctor in front of his name. And as you become in this medical field, as you become a part of the patient's medical team, I wonder how hypnosis is incorporated and received. And Patty, is it received differently as you present it than it is Dr. Rosen when you present it? You understand what I mean?
Mm-hmm. Quickly, I'll just say that I find that I'm received very graciously. A lot of times the doctors can be kind of frustrated, and also their patients. They're looking for something else, and if we can help their patient have a better sense of well-being, a sense of a little bit of control, and being a little calmer going through what they're doing, the doctors love it. So I find them to be a very essential. And hopefully it'll start to be the part of every team, medical team. You know, it's getting there. It's getting there. We can help.
Hopefully, yes. Hopefully, yes. And the more we do, of course, the better it will be. But
it's up to us.
There yet. So that's why I was curious how you're interweaving it through, and if it's different.
Dr. Rosen, you want to?
Well, it reminds me of a fellow that I worked with years ago, who came in and was going to be going for a knee replacement. And so was having tremendous pain, actually limped in with just misery, and sat on the couch, and we talked about doing hypnosis. And so we did an induction, we did a calibration of pain, and through some Ericksonian hypnosis, he was able to actually, when we came out of trance, he stood up, and actually I saw him like trying to put pressure on his leg to get pain.
Where did it go?
Oh my gosh, I can't believe my knee feels so much better. He went back to his physician, and he came back the next time in preparation for the knee replacement. He said, you know, my doctor would like more of your cards. It wasn't because I had a doctor in front of my name. It was because he was helped and he was able to leave the session with more comfort. That's what I believe treating physicians want. And I think it's what clinical, both clinical and certified hypnotherapists offer. I think once they know what you can do and it's done within scope of practice, you will probably have to put in more hours. That's
nice.
Well, about this time, we've got say, just about 15 minutes, 10 to 15 minutes left. I'd like to give the people that are on the call a chance, if they've got some questions percolating up, to begin to come forward, because I know it takes a little coaxing sometimes to get a word out of them. So anybody that does have a question, here's what I would suggest is the easiest way to go about it. There is a chat box. If you haven't seen it yet, down at the bottom of the screen, you can just click chat and it'll put a little box on your screen. And it's not that I want you to ask the questions in the chat box. We'd love to give you a chance to talk. So if you could either just put a question mark in the chat box or write, I have a question, or something like that. Or if you're really shy, you could write the whole question out. But just write that, and then we'll call on you. We'll open your microphone up, and you'll be able to speak directly to Eric or Patty, and they can answer your questions. I'm looking forward. I'm excited about it. And here's what I'd like to ask you, you guys, because here's what it takes to get me to sign up for a seminar. I have to picture it. I got to get it in my mind. What's it going to look like? What's it going to be like when I'm in there? And when I know something about that, then I'm like, I want to be there. So tell me about your room. If I were to walk into your room in the middle of the training day, what would I see happening?
Well, depending on what time you walk in, you might be seeing us explaining some things. It's going to be both didactic, it's, different types of training, but definitely experiential. I think that's important. You might see some people working one-on-one with each other, with us supervising. You might hear us just you might see us doing some demos, and definitely we got some PowerPoint bullet points we're going to be hitting during the training, and a nice handout. So it just depends on when you happen to stroll in the room.
Cool.
And so people will take away different scripts and a set of techniques you mentioned.
Yeah. Again, it'll be some simplified, just bullet points of some basic techniques that we are going to, that they can expand on. And it's more about the direction they want to go with the interview, and what is the starting point, the most important thing to get them to start listening to the person, to see where is it that you would start with this person, and what is a technique? Would it be a regression type of technique, or a timeline, or would it be maybe a parts type therapy? Just to see where would be a good starting point for them, and then, do a little abbreviated process to see if there can be some movement in that area.
Nice. So we've got a question in the chat box, and somebody who chose to just give us the whole question, so I'm just going to read it to you. It says, if a client has genetic alopecia, can hypnosis help change DNA and or genetics, or is this ailment incurable as established by the medical profession?
Might get different answers on that one from us. I don't know. You want to take that one, Eric, first?
Well, I'm always amazed with the techniques we use in the outcomes that are possible. I'm also very mindful of not wanting to promise something that we may not be able to offer. Is it possible that even with different types of medical issues that may not be responsive to conventional methods, that you might find relief through hypnotherapy, possibly relief to the extent that people can live lives feeling more empowered, less discomforted. And on rare occasions, I imagine there might even be that kind of remission that could happen. But I can't say starting out that I could change DNA, or that I can change the direction of the disease process, because I think that's a scope of practice issue. But I wouldn't want people to give up hope, but I also want them to be realistic.
Yeah.
And a little bit different. I kind of come from the Bruce Lipton school of DNA. He was one of the teachers that was on the board where I first started learning out in California. And I'm impressed with even things that previously had been thought, you know, to be genetic, and those kind of things can be sometimes affected. Again, as Dr. Rosen said, always being extremely cautious, not to make promises, not to, but what I usually do is I'll look for alternate cases. I'll look for, I don't think there's a single disease, condition, syndrome that someone somewhere in the universe hasn't recovered from, or at least partially had some relief in some way. So to me, if one person could, and if the person in front of me wants to give it a shot, I'm going to open up my scope of what I have previously thought was possible in that realm. And I'm going to see, well, what is this particular person may be able to do that might make the history books? Who knows? Again, without promising or trying to create some kind of an unrealistic expectation. But I think sometimes the inner person knows something's possible when maybe the you know, books don't necessarily back it up yet.
Sure, and I suspect that hypnosis can help us manage conditions, whether they're genetic or not.
Absolutely.
So as opposed to saying we can change the DNA, it just might be that what we can do is we can help a person organize their responses so that that individual, regardless of their DNA, can be able to respond to it or you know, more effectively than they were before.
Absolutely.
Nice.
And we have one more question. We have a couple of moments left from Jerry, who wants to know, he has a client, Jerry does, who has a loss of the sense of smell. He's wondering if you have any suggestions. He's looking forward to helping her, but he wants to know if you have any suggestions for helping her.
Hypnotic suggestions, I hope.
Eric, you had something similar, why don't you?
I did, actually. I had a cancer patient years ago, and the physician actually sent the person to me. They actually, because of their chemo, they actually lost their sense of taste and smell. And so, and they were on a feeding tube. So I actually did hypnosis to actually bring back a sense of taste and smell. And what was remarkable is that they actually did go home and they started eating again. And but what was fascinating, this whole issue of the meaning of the illness, is that I actually did get a change where they were able to start to taste some of their food, which meant that they wanted to eat again, but then they kind of backslid into not eating. And we actually had to use hypnosis to look at the meaning of what was happening with the illness. When we got to that, they were able to start eating. So it was a little bit of a combination of changing senses through hypnosis, excuse me, and also looking at the meaning of what their illness had done and what it was taking away from them. And so I think it is possible to get a change in senses.
Great. Okay, well, I think we've got time just for at least one more thing that I'd love to hear about, because I'm a dreamer. I'm wondering, as you, this is a fascinating field, and it continues to grow, it continues to change. We continue to learn more and more geometrically. So I'm just wondering, as you look to the future of medical hypnotherapy, where do you think this is headed?
Well, I think it's going to be, from this point forward, being used a lot more, number one, and starting to, I mean, it's been decades since a lot of very well-known people have recommended that it's taught in the medical schools, and it hasn't quite gotten to the scope where I hope it would. But I see it in the next 10 years, I believe medical hypnotherapy is going to be a mainstream normal thing that is a part of every team, every health team working with patients. I hope to help make that happen.
We can only hope, yes.
You have a vision for us, Rick?
I'd love to see it as a complementary treatment and method that the conventional world would see as viable and helpful, and also because it's empowering.
Nice. All right, so this is going to be an exciting one. May 20th and 21st, the Medical Hypnotherapy Specialty Certification Training at the Iact IMDHA HypnoExpo. Once again, so hey, we are looking forward to that. And it's almost time for us to say goodbye. And I got to tell people, make sure, this is an issue every year, is that there are these things going on and they're before and after the conference. And the first word people get is there's a conference coming. It's coming up in May, and it's the 17th through the 19th, and they make their reservations and stuff, and then they go, dang, I wish I had stayed around for that other deal. So really, take a moment to think about this, and when you decide that you want to take this training, then go ahead and book your airline reservations to include the 20th and the 21st, so that you can spend a couple of days with Patty and Eric, because it sounds like it's going to be wonderful. I got to tell you what I'm concerned about. You know what I'm concerned about?
What?
It's not possible to be in two places at the same time.
Oh.
And yeah,
you said we could get CEUs for both, so it's sort of like that.
Yeah, well, in a couple of minutes. Well, that's right. So exactly, so you can get Iact CEUs for attending your medical program, and at the same time, Dr. Kweethai is going to be in another room, teaching how to run a manifest a successful hypnotherapy practice, doing her 2-day post-conference. And we're going to be talking to her about that in just a minute. So, oh my gosh, what is a fella to do? So invite your friends, and have your friends attend, Patty and Eric's program and take really good notes. And you attend Dr. Kweethai's program and take really good notes. And then y'all can get together and just go to town with this great material. So I'm really looking forward to seeing you in Daytona, you guys. It's lovely. And Patty, I'm going to see you next weekend. Eric, am I going to see you in HEA?
I think I'm going to stop by.
Ah,
great.
Lovely.
Between now and the conference, if someone has questions about your workshop or has just questions I want to run by you, is there a way to get in touch with each of you?
Absolutely. Well, we also do medical hypnotherapy 4-day training here once a year in Tampa Bay area. But uphypnosis.com is the website for all the classes. Up, like look up in the air, right? Uphypnosis.com. And Eric, do you have a contact for yourself?
Rosen, ROSEN, the number 6 at AOL.com. erosen6@AOL.com.
Excellent.
Thank you very much.
Okay, so in a minute we're going to switch over, but you've got like 1 minute left, and you know what I want to do with that? I want to do my favorite thing, something I'm probably going to get a reputation for, and that is because we so appreciate the time that you've spent with us and all the stuff that we've shared with you. And regardless, damn the blindfold, full speed ahead, as Walter Mitty would say. What I'm going to do is I'm going to unmute everybody's microphone. So in a great wave of love, they can all say thank you and how much we appreciate talking to you tonight. So microphones are open, everybody. Give Eric and Patty a round of thanks.
Thank you, Patty. Thank you, Dr. Eric.
Thank
you
you
very much.
Thank you.
Thank you.
Enjoyed it. Look forward to seeing you.
Thank you.
I love it.
Okay. Well, and I'm about ready to push the mute button once again. So pardon me. And thanks again, Eric and Patty. We look forward to seeing you. And Karen, I'm going to need to reopen your microphone, There we go. So here we are of the second half of the program. Karen, are you ready for this?
I am very ready for this. Time to press on, because I think we're going to use every second of our time. Would you bet?
Oh, I do bet, because I know that Dr. Kweethai always has a whole lot of stuff to say to us. She's a great person.
Yes. And in case, I can't imagine that you don't, but in case you don't know, let me tell you a little bit about Dr. Kweethai. Formerly a professor of health, she's the chief catalyst of change at the iHealth Center for Integrated Wellness in Roanoke, Texas. She's also the master instructor for iHealth Hypnotherapy School. Believe this or not, she built a successful practice 2 weeks after certification, and she completely replaced her income as a university professor in her first year of practice, and she's been financially successful ever since. Sounds like bragging just a little bit, doesn't it? That is true.
If it's a fact, it's not a brag.
That's what I was going to say, Kweethai. Many hypnotherapists have acquired great skills, but to build a successful business in this field, you have to have some business acumen, and she does. She's a successful and brilliant business consultant. She's offering a 2-day intensive workshop on how to build a successful practice that suits your style of work. And that is my very favorite thing about this, Kweethai. Manifest a successful hypnotherapy practice, but it apparently is not one size fits all, because you seem to be a real believer in do you, be the best that you can be. Would that be true?
Absolutely. I think I see a lot of people going to this and that class, and they want to be a clone, and it doesn't fit. You know, it's like buying pantyhose. When I first came to this country, you know, you get to those things that look like an egg. You know, you look at the back, and you see small size is from 92 pounds to 145 pounds. 4'10" to 5'2", and I said that is from me being my natural self and being full-term pregnant. Now, how do you figure that I can fit in the same pantyhose?
That is a great metaphor and an example, and absolutely so true. Because there is, you know, there are lots of one-size-fits-all systems, but there are no one-size-fits-all clients, are there?
Absolutely not. Every client is unique, and every business is unique. And so if we try to do the same thing, if you want to be a fast food like McDonald's, yes, you buy a Big Mac, you're going to get a Big Mac. It's exactly the same Big Mac, whether it's London, Beijing, or Tokyo. But we're not Big Macs. And we are service providers. And I really believe in customized service for every single client. And when I teach my students, I tell them, please, I will teach you how to write a script. I will make you write a script. And then you will tear up the script. And if I ever see you reading a script to a client, I will beat you with my little baseball bat. I have actually a big baseball bat. I should bring it out and show you my baseball bat. And because I think for us to do really good work, we have to integrate our work to serve the client. So how could we possibly read a standard script to a client?
That's so right. Well, that's really lovely, Dr. Kweethai. I want to tell you, I just, while we're sitting here and watching you on the screen, I just reached over to the bookshelf next to me, and I pulled out this.
Yeah, I've got mine too.
yeah, there you go. Which is how to build a six-figure hypnotherapy practice from Kweethai, Dr. Kweethai, and this is now in its third printing. And I know that you have got a number of, you know, professional business clients that you work with and all of that stuff. So what is it that drives you to offer, you know, a class like this one when you could just be out there just doing it all on your own?
Well, actually, I should rename the book, because in the last 15 years, I think now I could say that I have brought in over 7 figures in client fees in my entire practice life. Okay, so why am I doing this? Because not everyone can afford to come and see me one-on-one. Because when they come to see me to consult one-on-one over 5 days, my fee is $20,000. So I think there are so many practitioners I see out there. They spend a lot of money training, and they're good people. They have great intentions, and they're not making the money they should be making. There's something wrong with that equation, right? So I think this will be a very good start. Everyone can start with a basic business plan and get going, and then start building their business in a positive way.
Mm-hmm.
We have problem with sound.
No, you know, actually, you're watching me type because somebody has asked to see the name of your book in the chat room so that they can use it. So
I think Michael and I were racing to get that answer up on
yeah. I
how to build a six-figure hypnotherapy practice is the name of Dr. Kweethai's book.
Oh, yes. And you
And
can,
when both of the hosts are busily trying to answer a question in the chat room, we don't come in to ask the next question.
yes. And I'm going to you will put my website up when they order. You can order it from my website.
Sure.
Yeah, okay.
And I'm going to do something really nice tonight. If you have tuned in tonight, when you go order, let me know that you have heard this broadcast, and I will mail the book to you and not charge you for the mailing fee. I will absorb the mailing fees if you want to order a book because you've heard me talk tonight.
Nice. Can you tell us the address of your website so we can put it in here?
Is www.ihealthhypnotherapieschool.com.
Okay, right there, everybody.
Correct. Yes.
Great.
Okay, Dr. Kweethai.
Let me know that you have heard me talk, and when the thing come to me, I will not charge you I don't know how we do that, but
Okay.
I will let Steve take care of that.
I'll bet your technical director at iHealth.
My technical director is sitting across the table from me. Yes.
And I have faith that Steve will figure this out.
So,
So, Kweethai, I am a hypnotist. I'm not a business person. How am I supposed to write a business plan? I just learned hypnotherapy. How am I supposed to write a business plan?
Well, here's the thing. Most people, they're all excited. They get certified. I'm ready to go. But running a business is a totally different thing. And many practitioners, particularly those who call themselves healers, find it very difficult to ask to be paid for their work. I don't know how many people out there agree with me, but many people I have encountered at conferences, and they find it very difficult to ask for their fee. And of course, there's always this magic question: how much do I charge? You know, some people, you range from 50, 100, 200, 300, 400. Do you bill by the hour? Do you charge by the session? How do you sell your services? Now, I don't like the idea of selling. You know how we walk into a car sales room and the people come and they hover around you like eagles. Have you ever been to buy a car? All right. So I like to think that we are professionals and we're not hawkers. We don't go out and hawk our services. But when we hold ourselves in a certain way, what I like to do is to create an opportunity for people to buy. It's like, here's this need, and here I am, and I can help you. So that is the one area about how to market your business. But I am starting with the basic of how to create a business plan. What are you, what kind of services are you offering? What kind of clients do you want? Some people, have you ever seen those cards or websites? They list everything in the kitchen sink. I can help you do this and this and this and this, and they list everything. Now, I want to caution, please don't list on your website that you can cure medical conditions, because we are not medical practitioners. And even if you have a certification in medical hypnotherapy, we do not practice medicine. We can only help people feel better from their conditions, from their medical conditions. And so how do we know when we are writing in our advertisement what is legal, what is appropriate, what is right, and how do I draw people to come to see me? So when I'm working with my students and when I'm consulting with my clients, my goal is to help you find the best piece of you, to put that up. Every diamond has many facets. In some angles, they shine better than others. So instead of putting everything out in the kitchen sink, let's find a few things that you can do very well and focus on that. So in this workshop, I go through and the book, and I strongly suggest if you have a chance, this is the best $20 you're ever going to spend. And you're paying $20 for what would be a $20,000 consult, and read it first. First pass, just enjoy reading it. Then read it again, and the table of contents become your framework for your business plan. So when you spend 2 days with me, I hope you have read the book before you come. And I will go through, since it's not a huge class, I don't want a huge number of people. I want a small and intimate group where I can give you some individual attention and help you build your own business plan. So the first piece, I would help individuals figure out what are the 3 diamonds in your bag. What are the 3 things that you do the best, or 5, but no more than 5 things. Nobody wants to pay a high fee for a generalist. If you want to charge a respectable fee, be a specialist. Be good at just a few things, and people will look for you. So like people look for Michael Watson for certain specific things. You see the name Michael Watson, you know he's the NLP instructor, he's the NLP expert. You see Karen Han, and she has this special thing that you do with the words. So we know that each one of you have a very specific area. Then when we polish that, it's given that every well-trained hypnotherapist can do everything in the kitchen sink, can't we? We can do many, many things. But in order to build a business that has a specific business identity, we have to find the best in you. So that's what I would do for 2 days. I will help you find your best, your 3 diamonds, so to speak. And then we will come up with teaching you how to build a business identity. All right, for example, my brand is Dr. Kweethai. Forever I've been known as Dr. Neil in academia, but I'm coming out doing something new, and I want something different. And then I realized that my last name is always some guy's name, right? It's my dad's name, it's my husband's name. So Kweethai is the only piece that I can call my own, and I haven't met another person with the same name in this lifetime yet. So I decided I will be named Dr. Kweethai, and I do use my doctor title because my PhD is in health, and I am still a health educator, only that I have a better tool and I'm more effective as a health educator. All right, so that being said, then I would help the individual, help you figure out who do you want to draw into your office. You don't want to take everybody the cat drags in. People ask me, in your 15 years, what is your success rate? And I said, well, recently when I moved to our new home, I dismantled 15 years of case files. I sat on the floor for a week going through, and I realized that not a single person who has come to see me has ever left without a positive change. So if you ask me what's my batting average, my average is also my entire sample size. Everybody goes home feeling that they've gotten more than they paid for. That is also my business principle. When somebody comes to see me and pays for my services, I want them to know that the change, the results that I have helped them find for themselves is worth a lot more than the checks they write me. Mm-hmm. So then you realize, for example, I worked on a case with a client, and this was the case that prompted me to write this book. So this woman came to me. She's been a practicing hypnotherapist for 13 years. And she wasn't doing very well because she was supplementing the hypnotherapy practice with another income. And so I said, lady, you don't have a practice, you have a hobby. You know, when you go play golf, you have to pay to play golf. She was paying to practice hypnotherapy. And I said, I can help you. So that was the first time I did this whole business advisory package. So the lady actually borrowed money from her 90-year-old mom to come and do this. And I said, I can, after I did a full business analysis and looked at what she was doing, how she was doing what she was doing, I said to her, I said, I'll tell you what, she was working 7 days a week and bringing in about $3,000. And this was quite a few years ago. And so I said, how about if you work 4 days a week and bring in $10,000? That's the beginning of the six-figure income thing this book. And she says, what? I said, I can help you do that on one condition. If I say jump, you say how high, because we don't have enough time for me to teach you every step of the way. So if you want me to do this, I will completely revamp your business and tell you step by step what to do. Is that all right with you? And she was fascinated and she says, okay. So we did that and completely revamped her business and relaunched her business in March that year. By April 1st, and I swear it's not an April Fool's joke, she calls me and said, Kweethai, are you sitting down? I said, well, you sound happy. Tell me about it. And she said, I just closed my books for March, and I closed my books for $10,029. And I said, wow, great. I said, great, take the $29, keep the 10 grand, go out and buy yourself some lunch. Wherever, even today, $29 can buy you a fairly decent lunch, right? So that was the beginning. And at first, you know, we had to work through all her limiting beliefs and all her fears. And she says, well, if I drop these clients, I may not have clients. If I raise my fee, nobody come and see me, and so on. And she had a very diverse practice. And she also has a lot of people who call her up in the middle of the night and they haven't paid her in 2 years. Mm. And I said, you do not have clients, you have thieves. Right? If people use your services and don't pay you, they're stealing from you. So we completely revamped. And so about 3 months later, she flew to, I think that was the first year of HypnoThoughts. It was in June. She came to Las Vegas to see me, and she says, by the way, it's only June 15. I've already cleared my 10 grand. That's how I have money to come and see you for my personal therapy now. So how does that happen? Has it happened again? Yes, I'm currently coaching a young client who was a former student of mine. She may join us later in the evening. She has to attend a birthday party of her niece. And I've been working with her recently, and she's doing very well. She just got herself, she just gave herself a pay raise, and she just got a contract to do some consulting. And how do we do this? I think the first step is to help the individual get over the fear of success. I know many people know about the fear of failure, but really a lot of people are afraid of being successful. What would I do if I have all this money? Right? You know that people who win the lottery, within a year, they're back to square one and then worse because they don't know how to steer the money. So there are many steps to do here. And in this book, I go through the different steps. For example, if you're already running a very good practice and you're quite content, that's fine. Why live a good life when you have a great life to live? Can you, one of the things I do when I put people in trance, can you handle more enjoyable? Can you handle more successful? Would you like to be more successful? Can you imagine that your practice is more successful? Would you imagine that somebody, I actually had once, when I raised my fee at that time to $5,000 for the protocol, The woman said, I don't have time to go to the bank. Is it okay if I brought cash? I actually took a picture of it. That got this pile of $5,000 landed on my table. Imagine it, and it will happen. And so this time I call the title How to Manifest, rather than the book says how to build, right? This is a very practical thing. But in the course, I'm going to teach you that energetic piece in how to manifest the success that you want. And so, you know, I've never been this old, and I like to share my things, right? And I said, well, you know, I'm finally certified old, and you know, not getting on this Social Security, Medicare thing. I'm old enough now. Hey, I can buy a senior ticket at the cinema. I feel very rich, you know. I can buy a senior ticket. So I realized I have four pieces of my life's goal. The first one is to live well. The second one is to love wholeheartedly. The third one is to learn passionately. And the fourth one is to leave a legacy. At 66 today, I know I've done the first three fairly well. And now I want to focus on leaving a legacy. And that's why, to answer the question, you know, what clients, and I still have clients who come to me to do the business protocol. I want to be able to leverage this and reach as many people as possible. I see teaching at a professional conference is not a profit-making thing, but it is a community service thing. When I come at my own expense and I bring my technical director with me and bring two people to a conference, and you teach a class and you only charge what the conference charge, and then you have to split half with the organization, it's not a profit-making deal. But it is also important for us to give back to our professional community. And so I'm excited to do this.
Nice.
Because I'd like to see as many people as possible who would want to do something about being paid what they're worth.
Nice. Well, and we want to remind everybody, Kweethai, that this is, again, Manifest a Successful Hypnotherapy Practice. It is a 2-day post-conference. It is May 20th and 21st. So that means make sure, again, that you get your reservations in the right way, and that you're going to be around to do that, and that you bring a friend to attend Eric and Patty's program as well. So that they
can
yes. Tell you all about that one. Kweethai, I wonder if you could, you know, I'm just kind of a simple guy. You know, I'm looking here, I'm thinking this is really great stuff. And I'm just wondering if you've got some magic formula, because can you tell me what, and I think you've already begun to answer this question, but are there some fundamental principles, some fundamental characteristics that contribute to building a successful practice?
Okay, very good. I'm glad you asked. And a couple days ago, I was listening to Seth Godin on YouTube. You know, Seth Godin, famous, wrote a lot of books. And he listed 10 things to do to be successful. And I'm sitting there smiling because I said, yes. The first thing he said is to put in the hours. Okay, to put in the hours. And I said, yes, because if all the wonderful marketing things in the world is not going to help you if your product is bad. Right, so you've got to first hone your skills and have good service to provide. That is fundamental. Rule number one. I was talking to someone, I was in Las Vegas recently, you remember? And I was at lunch with someone, and a newly qualified hypnotherapist said, oh, how do you build a business? What do you charge, whatnot? Then I asked her, I said, what would you like to charge? How much money do you want to make? And she says, well, you know, I've just retired. I want to work 2 days a week. I want to make $5,000. I said, $5,000 a month? No, I want to make $5,000 a week. So I said, wait a minute. You want to work 2 days and make $5,000 a week. That means you want to make $2,500 a day. I'm quick at math. And then she said, then I said, you have spent a lifetime in your career. You're just retiring. Tell me, at retirement, what's your hourly rate? $70. Okay. So you spend a whole life at university, working in your professional job, and you finish your career at $70 an hour. You've had 300 hours of training in hypnotherapy. You want to go from $70 to $500 an hour? It does not compute.
Right.
So therein lies the idea. To be successful means that you feel that you are paid your worth. That's success, don't you think? When somebody celebrates you. I remember a long time ago when I was a housewife in Ohio, when bread cost 79 cents, and somebody offered me $2.50 for a loaf of bread I had made. I felt like I hit the jackpot. So it's all relative. So in this area, in the 2 days, I would help you figure out what is success for you, what is suitable for you. Hypnotherapy is not a get-rich-quick scam, right? Yeah. Hypnotherapy is a profession, which means that we have to put in the hours, get the right training, get as much as you can, and then hone our skills to become the expert that your client would feel privileged to pay you for your services. That is fundamental. So if you haven't got the right training and you come from making $25 an hour and you want to charge $200, we have to figure out how we're going to meet that gap. Because our clients are not stupid people, right? Would you, and actually in my book, I have a section that says, begin with the mirror test, all right? Get yourself a mirror, look in the mirror and say, will I pay $200 an hour to hire this guy to help me? Yes? If you won't hire you, if you are not prepared to pay that fee to hire you, then I ask the question, how are you going to get other people to engage you? So the put in the hours, do the mirror test are fundamental principles to success.
Kweethai, let me ask, because this comes up on hypnosis forums all the time. I'll bet you've seen this before. Do you ever discount your service? Especially, you know, sometimes when hypnotists first go into business, they want to do a Groupon or something like that, where they give a great big discount for services. Would you ever discount your services for Groupon, for clients, for friends, for family, for anybody?
Oh, that's an excellent question, and there's several tiers. Do I discount my services? No. Hell no.
I kind of knew that answer before I ever even asked.
Definite no, because everybody who's listening, please remember this. If you discount your services, you devalue yourself. Do not ever discount your services. Don't even use the word, okay? Number two, the Groupon thing is a huge mistake. Let's say if you do, just for easy numbers, if you charge $100 for a session, you go to Groupon, you have to discount it 50%. You have to offer it at $50 a session that you normally charge $100. And they take half of that, which means you're going to end up with $25 a session. And I know somebody who actually started her business and went to Groupon and had lots and lots of people, and all of a sudden you have 150 clients waiting for you. Do you want to work for $25 a session, right? And then the bad thing is every time you work that $25 a session, you feel bad about yourself. So don't do it to yourself. Set a fee. Now, recently this client, when I told her to set a higher fee, she was like, I said, do it, you won't go blind. What's the worst that could happen? Yeah? What's the worst that could happen? You'll be exactly where you're sitting. You haven't got that client yet. But there is a chance that the client would pay you. And she got it. She sent me a text the other night. It's like, woohoo! I said, that's right. I never doubted you. Why did you doubt yourself? Right? So no, I do not. Now, the friends and family thing is another big question. Okay. What I suggest is that in hypnotherapy, especially, I don't know, I do it as a form of a sacred contract between you, me, and God. If I do it for free, you will have a karmic debt. You will owe me something energetically. So, and also we know that people who have no skin in the game, they don't put in the work. Right? We are not magicians. Our work is magical, but we're not magicians. I can teach you, but I cannot learn for you. You still have to ultimately make that choice. So when people have no
investment
money,
Did we just lose Kweethai?
I think we might have Dr. Kweethai. Dr. Kweethai, you just.
Well, basically, her point is there. I think she's back. I think we just lost you, Kweethai, for just a moment.
okay.
You were saying, you know, if you don't have any, if you haven't made your own investment, then you're not going to make your own investment, basically.
Right. So with friends and family, depends on the situation. I have worked with people, I volunteered and worked at the battered women's shelter. And then there was this one lady who had a very dire circumstances. I said, I will give you a session. You have to give up something of value. And she says, oh, I don't expect charity. I can pay for it. So I said, I'm going to ask you to put something in a red envelope when you come to your session. After that, whatever you can put in it. And after that, you owe me nothing. And she was very proud. We were talking on the phone. She said, I have $20 in my wallet. I'm going to put all the $20 in the envelope. And I don't get paid till next Thursday. That was all she had. And I said, ma'am, nobody has ever given me such a high pay by giving me everything you've got. You know, that woman in the 2 hours I gave her turned her life around, and 2 months later came back to the group and said because of that session, she learned to take better care of herself. And in fact, after the session, we went into they have a lot of free shops inside, free clothes and stuff. She had a whole new outfit made up and all that before she came to the class. And she came back just before Christmas. She said, I'll have you know, I start my new job next week as assistant manager at Walmart. I was making $8.50 before. I am going to start my new job at $14.50 an hour.
Excellent.
I always ask for a red envelope for people who cannot pay, and I want to give to them, but I want them to take some responsibility for their own healing. So is that helpful?
Yeah.
Because they know, yeah, and a lot of times I just ask for $9 because 9 is a magic number. That we'll talk about that another time, but most people can come up with $9. And so for her to put $20 when I ask for 9 is a huge bonus.
Right, right. And Kweethai, a lot of this is perspective. There's one thing that I was hoping we would have time to touch on tonight, and I think that we've got a little bit of time that we can carve this out, and then there may be more time if somebody else has questions. But you also talk about joy, living your life with joy, practicing your business with joy. Sometimes that doesn't always seem congruent. How can you be a joyful business owner? Share a little bit of that with us.
Well, that's a wonderful question. I love your questions, Karen. Joy is a choice. Joy is a choice. No matter what circumstances, I get to choose how I feel. And sometimes, yes, we get clients from hell. But when we have a client that is so difficult, you start with sending them love. You do not need their permission to bless them. And when you open your heart and you send love and blessings to a person who's challenging, you also stop yourself from feeling any negative emotions. Because I believe you can only feel one thing at one time. You can't laugh and be angry at the same time, right? So you can't be joyous and frustrated at the same time. So at any moment, I get to choose how I feel. And I would say, oh, thank you, God has sent me a difficult problem because I'm extra special. I'm going to find a special solution. I just have to work a little harder today.
Nice.
And therein lies the joy.
Cool. So Kweethai, I'm just about ready to sign up. I'll tell you what I want to know is, there's so many wonderful things that you talked about already, and such a rich topic that you have. So just what specifically, for people that are curious, what specifically are you going to cover in the 2-day training?
Well, I would go through, if you look at the table of contents, I will go through that. But most importantly, my goal is at the end of 2 days, each one of you will walk away with your own business plan from your heart and from your soul. I mean, you can go online and take a business class anywhere. So why take a business class with me? I have taught business classes in universities the conventional way. But what I have found most rich is to follow your own bliss, like Joseph Campbell says. When you do something that makes your heart sing, it is not work. When you do something that gives you joy because you have made a positive difference in another person's life, therein already you have been successful. But the nuts and bolts of the money part of the business, I will also cover. But more importantly, when you walk away from the 2 days with me, my intention is for you to feel joyful about your work, feel excited that you've got a plan in hand, and feel committed that you're going to work the plan. A plan is useless unless you put it in action. I'm a tough coach because there's no point in talking about it. You have to put it down in paper. So it is an interactive workshop because you will pair up with other classmates and hold each other accountable. And better yet, I hope that after the class, the participants in this workshop will form themselves a nice little WhatsApp chat group and help each other. I will monitor these chat groups. I don't always comment, but I will monitor, and sometimes when there's a need to put in a comment or two, then I will help you do that. So 2 days of fun, 2 days of self-business therapy, 2 days of working through your own little kinks and getting your little bits of limiting beliefs out of the way, and extract the 3 diamonds that you have within you and walk away brilliantly shining.
Nice. So, and just one last thing that I want to make sure that we're clear about, is this a certification training? Do you offer a certification in this?
No. I think certification is, for this, is overrated. You know, people have to do 2 years to get an executive MBA. And what I will give the student is a certificate of completion of 2 days of work with me. And I think what is more important than that piece of paper, that no pieces of paper can do for you, is that sense of confidence and competence that you will put in action. And even if that piece of paper gets burnt away, nobody can take that away from you.
Now I like those pieces of paper that say 500 in the corners. Those would be very, very
I will make one just for you. I have these little $1 million bills that my financial guy at Fidelity, he gives them out at Christmas times. These little $1 million bills. Would you like me to bring you one?
Yeah, sure, sure. So I want to give a chance. We've got just another 4 or 5 minutes. We're almost out of time here. It goes by so quickly, especially when you're talking to somebody as wonderful and full of rich, fascinating information as Dr. Kweethai. So thanks for being with us. Just want to just put it out there. If anybody has any questions, it's the same thing as before. You can either write them in the chat room, or even if you just put a question mark or say, I have a question.
Oh, Suzanne says, how do we contact you? My website, ihealththerapies.com.
You hit the chat room. If you'll scroll up, you can get it. You can see it right up there.
Yes.
And we've also got iHealthHypnotherapySchool.com.
Yes, either one. You can go to, or you just Google me. It will take you to my website and send me an email with your phone number if you want me to call you.
Great.
You know, I think it would be very nice, Michael, if we could open Melanie's microphone and just let her say she's taken some courses from Dr. Kweethai. And
hello, Melanie.
That'd be great. Let me see. Here we are.
Hello.
Go ahead. Hi.
Go. A nice little testimonial here, Melanie.
Yes. I spent time in, I was just getting into the other room in October and December, taking over 3 weeks of courses, and it's completely changed my life. And beginning in hypnotherapy, I've done numerous cases and done everything Dr. Kweethai has said, letting the client guide me in all my questions. And I'm just amazed how well I can actually help somebody with my 220 hours of training. And what she has taught me is to continue to study, continue to learn, continue to read. And every day, you know, I'm doing a little and a little more. And just even listening to this conference tonight, just again, fills me with, you know, all that knowledge of teaching us in a hypnotic state for 3 full weeks and being able to download all the information. I mean, it's just, it's hard to explain.
Thank you, Melanie. And I see
You're
Kayla
welcome.
is on. Kayla recently made some major breakthroughs in her practice. Do you want to unmute her?
She is.
Oh, hi, Kayla.
For some reason, we can't hear you, Kayla.
Oh.
I'm sorry, but she does say that her business is making big dollars thanks to Dr. Kweethai. Thank you very
It's
much.
so much fun to help people become successful.
So after you take Dr. Kweethai's course, apparently, to handle all those big dollars, you're going to have to go out and get a bigger wallet.
Now it's all electronic. Just learn how to do bank transfers.
There you go.
All right. So again, May 20th and 21st, Monday and Tuesday, the 2 days following the weekend of the conference. By the way, Dr. Kweethai, every time I think about Daytona Beach and the conference there, I am reminded of the first conversation that you had out by the fire pit in
the fire pit.
What a lovely conference it's going to be. So everybody, you want to come to Dr. Kweethai's program, of course. And those of you who can't do that, it will be because you want to come to Eric and Patty's program, of course. And of course, all of you will want to join us out by that lovely fireside and the beach on Friday night.
Can we have a moment for Kayla? She's on now. Can she come on the air?
I think that's up to Kayla.
Kayla, can you come on?
Her microphone is open.
You can speak.
No, we can't, Kayla. I can read your lips, but we can't hear you.
Huh. Oh, well. We'll see Kayla at Daytona. I know she's coming.
Yeah.
There you go. And we will get together and talk around the fire pit, and before for a couple of days, and then in Dr. Kweethai's workshop post-conference.
Yes, indeed. So that is our time. So I want to let everybody know, thank you again so much for being here. And Dr. Kweethai, you hang on for a second because we're going to give you that send-off that we really
Oh, all right.
And everybody, the replay of this program will be posted tomorrow by noon at the latest. You can find it on the Iact IMDHA forum, the Mind Matters forum. You also can find it on the Iact or IMDHA websites themselves under the teleconference tab. It will be posted on the virtual chapter, the group that Karen and I manage on Facebook, and it will also be posted on the virtual chapter's YouTube channel. So you're going to be everywhere, Dr. Kweethai, and people are going to know you around the world if they don't already.
Well, and I want to thank you, Michael and Karen, for doing such a fine job, and it's fun talking to you.
Well, thank you for joining us. It's been great.
We really appreciate it. And now I'm going to unmute the microphone so everybody else can send to Dr. Kweethai on a bon voyage, and we'll look forward to seeing you in Daytona Beach. The microphone.
Thank you, Dr. Kweethai. See you in Daytona Beach.
Don.
Hello.
Hi.
Tell me what you remember.
Thank you, Dr. Kweethai.
Thank you, Dr. Kweethai. Love you, Dr. Kweethai. Thank you so much.
Good night.
Thank you.
Thank you.
Good night, everybody. We'll see you next week.
Thank you for that, Celia.
So much fun.